Okay, so I thought I would put a little video together to assist you with the postural alignment training that we need during during the different classes, and but also that you should do throughout your day and try and recorrect, because it will help you daily and also help maintain the practice that you are doing during your class. It will help maintain what you've learned, but also retain the release and then the alignment that you get from releasing those restrictions in classes. So we want to maintain that. Now, so in our daily lives, we tend to um, stand on one leg, stand on the other leg. We tend to lock our knees. So we should try and keep more loose knees on a regular basis. And also, another tip, try and correct yourself. We're standing around the kitchen. I know we're all having fun. We're talking, and we tend to do this or that, or we're just leaning in funny areas. And, we don't tend to think about it, but try and just recognize it and then recorrect. you know Recognize it and correct yourself, because this will all help you stay in alignment on a regular basis. And of course, our feet are actually meant to be just underneath our hips, and a lot of people think hip width is here, but it's not. My hip bones are right in here, and so they're a little bit closer in than we think they are. And then, of course, feet straight. So a lot of people tend to have their feet more in a duck shape. Okay, so we want to recorrect our feet and make them straight. I know that can be tough, but if we keep recorrecting ourselves slowly, we can create habits, of course. Um, and so this is also a sign that your hip flexors are too tight. Okay, so then maybe if you see a big flare in your feet, too much pronation, we want to really get in those hip flexors, loosen them up. So that's just under the ASIS bone and working in that hip flexor area. All right, and so then one of the core ones we could do is, so often what you'll see is hyperextended knees. Okay, we want to keep our knees soft and we want to keep our posture good. So what you'll see in daily life, a lot of people, just keep an eye out too and watch people's posture. You'll see people tend to start doing this, right? Rounded shoulders. My core is sinking in. My ribs are now squishing all my vital organs, which can cause a protruding in my belly. Sorry, I have a tough time making it happen. But all these things can cause just detriment to your health. So we want to correct that. We want to have not locked knees. I want to bring my head back. I want my shoulders back as much as possible and down. And so then you can see that my ears should be above my shoulders. My shoulders should be just above my hips, and my hips should be above my ankles. And the knees not necessarily in line because we don't want them locked. So just practicing those posture, realigning yourself on a regular basis can definitely help open up that space in your ribs that you need as well, right? Giving more room for your lungs to expand, giving more room for your organs to have a space. So correcting your posture on a regular basis. Okay, and so then breathing through your nose, that diaphragmatic breath, all very important things you can practice daily. We're going to practice these things throughout our classes, but try and continue to practice them throughout your daily life. Diaphragmatic breath alone allows you to increase your oxygen intake by 600 times. So that belly breath, a nice belly breath, chest breathing does not do that. Also, chest breathing doesn't allow for the oxygen to get to the very bottom of your lungs where the oxygen receptor sites are, called alveoli. And that's why you get more oxygen in when you diaphragmatic breath. See, when I diaphragmatic breathe, my belly pulls my diaphragm down, and then thereby pulling my lungs down, pulling the oxygen down deeper into the bottom of my lungs. That's why I'm able to increase my oxygen. Okay. And then, of course, when I exhale and the diaphragm goes back up, it helps push out the debris and the waste and that gunk that's stuck at the bottom because we never get down there with oxygen. We can't get all that gross stuff out. So it's two-way street there. It's good. Diaphragmatic breath is also great for massaging, constantly massaging your organs. Think about it here. My diaphragm's right here. I inhale. Okay, so it's going up and down, and then think about your body as a canister. So my diaphragm's here, my pelvic floor is here. Also going to help slightly strengthen the pelvic floor because it goes up and down as well. Okay, so think about it, it's massaging my organs now. So it's helping maintain the function that we've given those organs by practicing the block therapy, but diaphragmatically breathing, and then massaging those organs on a regular basis helps them not get stuck again, stuck where they were. So diaphragmatic breath, breathing through the nose, because of course it filters everything better for your lungs and your body, keeps debris out of your body, recorrecting that posture. And then of course, tongue docking. So if you feel those ridges behind your teeth and you place your tongue in that soft palate, it fits nicely there. And did you notice that when you dock your tongue, it's pretty hard to mouth breathe? So it actually also forces you to breathe through your nose. So that tongue docking can help you breathe through your nose, but it also helps support the weight of your head. And also it can help realign your head to be in proper posture where it should be down the chain of events here. So tongue docking. And then finally, making sure that we root. Okay, so rooting is when it's the action of squeezing your anus muscle. Okay, and so then if we were to take this block, which can help us assist in this feeling, and we can bring it in between our legs, okay? So depending on you, I don't know, you might need the block sideways. That's too much for me. But we'll have it on its side, really nice up in your groin. And just squeeze that block together, okay? Nice loose knees. See how my feet are nice and close together. They're straight, right beneath my hip bones. And then, of course, while you're here, let's squeeze that anus muscle. When we squeeze that anus muscle, we're able to realign our pelvis. Some people's pelvis are too anterior tilted and some are too posterior tilted. So I think mine's in pretty good alignment, but what that looks like is some people, it's actually hard for me to do. I've corrected mine, so now I'm having a hard time demonstrating. But so some people have their butt kind of sticked out so that their pelvis is tilted the wrong way. And then some people do this too much, sway back, and then their pelvis is tilted in too much, okay? And then you can see the locking of the knees happens more. Look at the pressure on my back. So if we can get that posture back and my pelvis aligned, and you'll see. So if I correct myself, as I squeeze my anus muscle, you'll see my pelvis stabilize. It will come to neutral. So my glutes are slightly squeezing together. I'm squeezing my anus muscle, and my posture is realigning. So practicing that rooting during the pelvis and legs class actually helps you stabilize your pelvis during the moves, and you can practice on a daily basis. So to summarize, we're going to want to breathe through our nose. We're going to want to diaphragmatically breathe. We're going to want to try docking our tongue as much as possible. We're going to try and correct our posture as much as possible and rooting so that our pelvis is more aligned. And then we're going to want to stand, not with one weight on one side too much, trying to recorrect that, and then keeping our feet together and straight forward. So I hope those tips help. We are going to practice them on a regular basis during the classes, so that will help you be familiar when I talk about docking your tongue and rooting, diaphragmatic breath, breathing through your nose. All these things will be during your class, but we want to maintain all that work we've done. So try and keep doing it when you're not in class as much as possible. Thank you.